Hey guys, it's Alex from Dental Growth, and in this video I wanted to go over a quick case study of some results that we were able to achieve running marketing for a dental practice. And this result was achieved a couple months ago, but we spent a little over $1,100 and we got over 130 leads at about a cost per lead of $8.83. And we were able to get over 44,000 impressions, which are just people seeing your ad, seeing your post, seeing your practice. However, some of those may have been repeat impressions, and over here in the frequency we can see about on average someone had viewed the post about 2.45 times, so that impressions number is closer to probably something like 20,000 people have seen the actual the post, right? Which is awesome. You know, in your local area, getting that type of visibility is great. And we were able to get over 130 people reaching out and saying they were interested in dental care in some capacity. Now, this was actually an implant campaign, so we were mainly talking about implants in the ad. A lot of the pictures had to do with implants and things like that. So we would get information and just ask people what brings them, right, in general, because on Facebook you can't necessarily ask certain personal attribute health related questions, such as insurance is a big one. You can't necessarily qualify on an in-app lead form about insurance or what their health status is or what their dental status is, etc. But we could ask a more general question: what brings them today? And a lot of times people would say stuff: missing a tooth, broken tooth, interested in implants, interested in implant denture. So everyone there had some type of dental need or some interest in implants, and it's up to us from there to kind of manage those inquiries from there. And typically we see that a good percentage of leads can be booked into new patient appointments, around 20 to 30% at least, if lead management is optimized to a good speed to lead, where you're reaching out to the leads very quickly after they come in and having a good follow-up system over time to reach back out to the lead if you aren't able to get in touch with them on the first chance per se. So pretty awesome. And again, I mentioned, I think that this result was achieved a couple months ago, but I did want to touch on it because we did get a great result here, spending, as I said, over $1,100. And if you are able to get at least a couple new patients from this campaign, guys, you can especially for implants, you can very quickly see how this can be a very profitable thing, as long as your team is able to manage, the inflow, and ask those questions on the lead call, when you're talking with the lead, when you're talking with someone who's raised their hand and they're interested, making sure that, the insurance piece checks out and making sure that, there would be a good fit coming into your practice. And that's another reason why we really go for this high volume approach, to get you as many opportunities as possible, because as I might have said in some of my other videos, dentistry is there's a lot of different moving parts. And so if you were to try to make someone jump through a bunch of hoops on the front end, figure out this, figure out that, figure out the insurance, do they need a referral, do they have this in place, do they have that in place, are they close enough, it's just a lot, and you're going to have to figure all of that stuff out on the call when you're scheduling the patient anyways, and that's a great time for your front desk to do all of that as well. So we give you a bunch of opportunities, and you can kind of see from there if there would be a good fit, and you guys can book them in and hopefully continue treatment. So yeah, so a pretty awesome result here. My question would be, what would you be able to do with over 130 people reaching out and saying they were interested in a procedure or an offer that you had on your post and kind of interested in coming in, right? So definitely a great opportunity here. And that's why digital advertising is awesome, because you can very quickly get a bunch of people really showing interest and connecting, right? Because it's very easy for someone to just tap once, tap twice, and now you have their information, their phone number. You can get in touch and talk about moving forward with treatment, or they tap once, tap twice, and now they're calling the office directly, as opposed to seeing something out there and then maybe having to type in the number on their phone, or just kind of or compared to organic, having to post a bunch and not really sure what the actual results are on the back end and the return on the time and investment that you're putting into that. Whereas with digital advertising, in a matter of days, you can turn on something and have software actually show your office to a bunch of different people. So it's very leveraged and very efficient, and you can get a ton of opportunities for a very good price, especially if you kind of know how to know which images and offers work and which ones don't work, and you're able to see something that is working statistically, on our ads manager, and then, spin that off into more similar ad sets that are also going to do well. And now you're scaling up something that is working very effectively because you have all this data in Ads Manager, as opposed to you can't have that data in, say, like a newspaper ad or something like that. You just can't track all of this stuff. Whereas the beauty of digital advertising is you can track everything and really hone in on what's working. And that's exactly what we did here. And we were able to get leads for under $10 a piece. So we're getting people interested in implants for under $10 a piece. And it's up to the office to kind of work their magic and take people from there, right? And so it's great if your office is just looking for as much flow as it can handle, and then kind of manage the qualifications from there when you are scheduling and moving forward with treatment. But if you're just looking for a bunch more opportunities to grow your existing practice, grow a new practice, expand, focus more on a specific treatment type, such as implants or full arch, and kind of grow that side of your practice more and diversify from bread and butter, then that's a great way to do so. So quick case study here, guys. Thanks for watching. If you were interested in getting the system implemented in your practice, definitely feel free to book a call with us in the link below, and we'd be happy to help. Also, if you're an agency owner looking to kind of do what you do better, feel free to book a call in the agency link. I'd be happy to chat. That being said, guys, I'll see you in the next video.